Today's video is about if you are one of the medical graduates from abroad and you want to work in Australia. So what is the easiest way for you to come in Australia, especially if you are just MBBS? So my previous videos I already told that what is the ways to come to Australia. But this is one of the videos that, as you know, in Australia, if you want to come here, there is 3 pathways you can come here. First is the competent authority pathway. You must be in that category. Second is a standard pathway, then you have to write 2 exams, and you know the AMC1 and AMC2, and that you can come to Australia. And another one is a specialist pathway. You want to work. Specialty means you are one of the specialists, one of the area, then you can come in that way, or you want to study here in the specialized area. So we'll see that these 3 videos for each of the pathway. My name is Dr. Akram Ahmad. I'm here as a lecturer and researcher. I always make videos for healthcare professionals, those that want to come to Australia, they want to work as a doctor, pharmacist, physiotherapist or nurse, whatever. So if you are one of the new in my channel, so please subscribe my channel and you can watch my previous videos. So if you want to work in Australia as into the competent pathways, then you must have to be registered in one of these countries. Okay, UK is the number 1, that is the GMC, General Medical Council. You must be registered there. Then you can just come to Australia, you can work here. Number 2 is that if you are from Canada, you are registered doctor there in Canada, then you can work in Australia without writing exam. And another one is US, then is the New Zealand, and then is the Ireland. If you are from one of these countries, so you can come onto this the competent pathway. Otherwise, you have to go for a standard pathway, you know. So I did my own research. So based on this research, you can come Australia very easiest way. If you want to work in UK, there will be a same process like Australia. You have to write there the 2 exams, that is PLAB 1 and 2. Then you can work in Australia, you know, to work in UK. But in Australia, you want to work, then you have to AMC1 and AMC2. So I'm just comparing here. So if you are planning to come Australia, you have to write AMC1, and AMC1 has the passing rate in Australia is about 55%, but there is a AMC2. In AMC2 is only the 10 to 15% only doctor passing rate for this exam. This is a clinical examination, and passing rate is very low. The fee for AMC1 is at 2,700 Australian dollar, and for AMC2 is a $4,500. So if we are totaling is about 8,000 Australian dollar you have to spend if you are planning to come Australia. This is only in the condition if you fail, then you have to again pay 1,700, you know. And many of the people are fail, and they give 2 times, 3 times, 4 times these examinations. So you have to spend a huge money on if you want to come to Australia. But on the other side, if you want to go first to the UK, and you can come to the Australia, because in the UK nowadays there is a shortage of healthcare professionals, especially the doctors, because they are hiring a lot of junior doctors because of the Brexit. Brexit means after the Brexit that lot of the people those are from other countries in the European Union, they cannot come to work in the UK. Earlier in UK, anyone from those countries they can come and work. There is no need to write any exam or any visa or something. So now they have to get a visa similar like us if you are from India or Pakistan, something like this. So after this Brexit, lot of people are go back to their country. Very easiest way they are giving the visa nowadays for healthcare professionals, and writing an exam and passing exam is very easy as compared to Australia. So here is my analysis that PLAB examination, if you want to write one, there is a fee just $450, and here you have to pay for Australia 2,700, but here you have to pay just $450 Australian dollar. I just converted here, maybe somewhat more and less, and the passing rate here 65%. So the AMC1 is a 60%. The passing rate 55%, up to here is a 65%. So there is a more chance to pass that PLAB exam. So another one is that the PLAB second part you have to write there, but that is a fee is about 2,000, and here you have to pay 4,500, you know. And again, to the passing rate is high as compared to Australia. I have just 10 to 15%. Here is up to 25%, you know. And the most important, if you write AMC1 and AMC2 and you want to come in Australia, it will take you to get first job maybe on an average is about 18 months. It can be more. Many people are here like after 2 years they are not getting a job. Some of of them after 1 year they are getting a job, So it's up to the person to person, but on average it will take 18 months to get job in Australia. You will be registered doctor in UK, and later you can come to Australia without writing any exam, few months. It will take I think 1 to 3 months to register with APRA. APRA is the authority in Australia. If you want to work as a healthcare professional, maybe you are a doctor, pharmacist, anyone, you have to register with APRA. The APRA one of the body here. GMC is the General Medical Council for UK. So you have to must register there. So the conclusion in the video, you have to pay very less money in the UK if you want to register there as a PLAB. You have to write PLAB2, and then you can get a job, and visa also they are given easily as compared to Australia. So once you registered there, and later you can migrate to the Australia. Now you have two advantages. If you like UK, you can work there, but lot of doctors are here. They are coming from UK to Australia. Not only the doctors, lot of the professionals. If you see a scenario here, the maximum migrant are from UK, still in the Australia. They are migrating to the Australia. So simply ये है कि अगर आप ऑस्ट्रेलिया आना चाहते हैं तो इजीएस्ट वे है कि आप पहले यूके में रजिस्टर हो जाएं और 1 साल वहां काम करें, उसके बाद आप जो यहाँ पर ऑस्ट्रेलिया आ सकते हैं। अगर आपको कम से कम जो 8,000 जो है डॉलर कम से कम खर्च करना पड़ेगा एक बार लिखने के लिए। अगर आप फेल हो गए फिर से आपको पे करना है ना, तो ये बहुत ज्यादा पैसे आपको पे करने पड़ेंगे अगर आपको ऑस्ट्रेलिया आना है। तो इसीलिए मैंने कहा कि पहले अगर आप 4-5 बार भी अगर फेल हो गए, फिर से दिया तब भी उतना अमाउंट नहीं हो रहा है ना, तो आप जो है रिस्क ले सकते हैं यूके के लिए। पहले आप रजिस्टर हो जाइए यूके में, उसके बाद आप जो है ऑस्ट्रेलिया आ सकते हैं। थैंक यू फॉर वॉचिंग दिस वीडियो।